in just so she can feel me against her. And then it's always the opposing shoulder that is over top, unless for some reason that is uncomfortable. And doing preliminary bumps, so it'd be like that, and making sure that they feel comfortable before you actually just drop on them. But that feels okay? Mm-hmm. Great. And then I'm going to put one leg out straight and one leg here. The purpose for that is, one, it creates a little bit of obliquity at the pelvis, allowing for a little bit of this kind of side bending and gapping of the facets higher up the chain. Secondarily to that, the patient can actually assist you with pushing themselves over with their foot as you get your hand in the right position. So my position is going to be like this, where I have the spinous process right at my fingernails, or right in this groove, and my forearm is going to be in this position with a ulnar deviation at the wrist. The significance of this is because her scapula is going to, the medial border of the scapula is here. I'm not going to be like that because a lot of my force can go into the edge of the scapula. Okay, so it's going to be like this, and it's going to be like a pull down and a simultaneously side bend. So, Pilar, I'm going to have you go ahead and push yourself over. Again, you're going to feel the edge. Thanks for that. So then I'm going to feel spinous process there, and then you may have to do an assessment prior to getting them into this said position. But once I'm here, I can kind of move myself up and down the spine to feel for tone. So I feel this a little bit more, right, than I do up higher. So that's going to be our target segment. I'm going to come up and under where I have my thenar eminence on the right side of her T-spine. And then as I roll her over, it's going to be this simultaneous motion like that. So I like hold her down into extension. And then typically people want to go like this and like put their hand there, but you're going to create some side bending and some leveraging by getting over top. And then it's right at my xiphoid. So I'm just like this, big breath in, big breath out, and I already went with the setup.
And while laughing.
Yeah. So you can do that same setup